Before we begin, this video is for general educational purposes only and is not medical advice. Please consult a healthcare professional regarding your own hearing or medical condition. Welcome to Health is Wealth, the channel dedicated to helping you live better, feel better, and know better. Have you ever heard a ringing, buzzing, or hissing sound and no one else in the room could hear it? You're not imagining things, and you're not alone. Today, we're going to break down exactly what tinnitus is, what it isn't, and what you actually need to know if you or someone you love is dealing with it. Tinnitus, pronounced tinnitus or tinnitus, both are accepted, is the perception of sound when no external sound source is present. People describe it in many ways: ringing, buzzing, hissing, whooshing, clicking, or even a low, persistent hum. It can affect one ear, both ears, or seem to come from inside the head itself. Here's the key thing to understand. Tinnitus is a symptom, not a disease. It's your auditory system signaling that something in the hearing pathway from the outer ear all the way to the brain has been disrupted. That disruption can come from many causes: noise-induced hearing loss, aging, ear infections, earwax blockage, certain medications, or even jaw and neck tension. According to the American Tinnitus Association, roughly 15% of the general population experiences some form of tinnitus. That's more than 50 million Americans. For about 20 million, it's chronic. And for 2 million people, it's severe enough to significantly impact daily life. There are two broad categories worth knowing. Subjective tinnitus is the most common. Only you can hear it. It typically originates from problems in the outer, middle, or inner ear, or from how the brain processes sound signals. Objective tinnitus is much rarer. This type can actually be heard by a clinician using a stethoscope placed near the ear. It's often caused by blood vessel conditions, muscle spasms, or structural abnormalities, and it's more likely to be treatable. This is where a lot of confusion and a lot of unnecessary fear comes from. Let's set the record straight. Tinnitus is not a disease. It's a symptom. That matters because it means there's usually an underlying cause to identify, and addressing that cause may improve or resolve the sound. Tinnitus is not a sign you're going crazy. The sounds are real. They're generated by your own nervous system. The experience is entirely valid, even if it's invisible to others. Tinnitus is not always permanent. Temporary tinnitus, like the ringing after a loud concert, often resolves on its own within hours or days. Chronic tinnitus is different, but even then, many people find significant relief with the right strategies. Tinnitus is not the same as hearing loss, though the two frequently occur together. You can have tinnitus with normal hearing, and you can have hearing loss without tinnitus. And tinnitus is not something you simply have to suffer through silently. There are evidence-based approaches, from sound therapy and cognitive behavioral techniques to hearing aids and lifestyle modifications, that help millions of people manage it effectively. Most tinnitus is not medically dangerous, but there are situations where you should see a doctor promptly. See a healthcare provider if your tinnitus started suddenly or after a head injury, occurs in only one ear, pulses in rhythm with your heartbeat, is accompanied by dizziness or sudden hearing loss, or is significantly affecting your sleep, concentration, or mental health. In these cases, your doctor can rule out conditions that need more specific treatment and get you on a path toward relief faster. One of the most important things we can tell you here at Health is Wealth is this: millions of people live full, active, productive lives with tinnitus. Awareness, healthy habits, and the right tools make an enormous difference. Protecting your hearing going forward, whether at concerts, on job sites, or while using headphones, is one of the most powerful things you can do. Stress management matters too, since stress tends to amplify the perception of tinnitus. Good sleep hygiene, regular physical activity, and limiting caffeine and alcohol are all steps that research supports. And staying engaged with your health, your community, and the right resources can make the experience feel far less isolating. If you're focused on protecting and supporting your overall health, hearing health included, we'd love to introduce you to HealthSteps, brought to you by the Health is Wealth channel. HealthSteps is a wellness app designed to help you build the daily habits that support your body from the inside out. You can find HealthSteps on the Apple App Store and Google Play, or visit healthsteps.us to learn more. The links are in the description below. If you found today's video helpful, please like, share, and subscribe to Health is Wealth, and drop a comment below if you have questions or topics you'd like us to cover next. Remember, your health is your wealth. Take care of yourself, and we'll see you in the next one.